அனைவருக்கும் வணக்கம். ஒன்டாரியோ மாகாணத்திலே ஒன்டாரியோ மாகாண அரசாங்கத்தினுடைய வரவு செலவு திட்டம் இந்த மாதம் 24ஆம் தேதி சமர்ப்பிக்கப்பட இருக்கிறது. இந்த வரவு செலவு திட்டம் இந்த கோவிட் பெருந்தொற்றின் மத்தியிலே மிக முக்கியமான ஒரு வரவு செலவு திட்டமாக பார்க்கப்படுகிறது. இந்த வரவு செலவு திட்டம் குறித்து ஒன்டாரியோ மாகாணத்தினுடைய பிரதான எதிர்க்கட்சியான NDP கட்சியினுடைய தலைவியும் ஒன்டாரியோ மாகாணத்தினுடைய எதிர்க்கட்சி தலைவியுமான ஆண்ட்ரியா ஹோவாத் தங்களுடைய எதிர்பார்ப்பு இந்த வரவு செலவு திட்டம் குறித்து என்னவாக இருக்க போகிறது என்பது குறித்து எங்களோடு நேரடியாக பேசுகிறார். அவரை வரவேற்று இன்றைய இந்த அவர்களுடைய இந்த கருத்துக்களையும் உங்களோடு பகிர்ந்து கொள்ளலாம். Ms. Horwath, thank you for joining us today.
Thank you. It's my pleasure to be with you.
The government of Ontario, the PC government, is going to be tabling their budget on the 24th, less than a week or within a week. As the official opposition at a time like we have never seen before, what are your expectations when it comes to the budget itself? What do you want the government to have focus on and give priority to when it comes to this budget?
Well, it's a pretty important budget, and I want to thank you for the question. We are hoping to see the government prepared to help people get through the rest of the pandemic. We are hoping that the budget provides hope that folks will be supported, that we'll be able to get to the end of this pandemic and start to rebuild. But there are some particular places where we want to see investments because we believe this is not a time for cuts. It's a time to invest in supporting people and helping families and businesses to get through. And so we want to see investments in our healthcare system. Particularly, we want to see some investments in hospitals, particularly hospital beds in communities that have been shortchanged for a very long time, places like Scarborough, places like Brampton. We want to see the hospital deficits. The hospitals have been building deficits through this pandemic, and we want the government to very clearly show that they're going to wipe out those deficits for the hospitals and provide the funding necessary to get rid of the backlogs in the surgeries. I mean, there's been some 227,000 people who have canceled or postponed their surgeries and procedures. We want a plan in this budget that outlines the quickest way possible to invest in getting rid of those backlogs and giving people the surgeries and treatments that they need. So that's just one part of the healthcare system. Another big part of the healthcare system that we all watched unfold, have tragedies unfold every single day throughout the pandemic, both first wave and second, is long-term care. So we really want to see this budget make the commitment to hiring the 10,000 PSWs that we need, to paying them more, more in terms of wages, providing better benefits, making sure there's 4.1 hours of hands-on care for every resident in long-term care, and making those jobs full-time jobs and careers that people can make a living at and support their families on, and instead of having to work 2 and 3 jobs because they're so underpaid. But I mean, I can keep going. There's a couple of more pieces if you want me to just list
Please
them
do,
off.
yes. Yep.
Okay, all right. Well, the other big piece is our kids and making sure that we're investing in schools, but particularly in education and mental health support. So we don't want to see any more, firing of teachers. Let's not forget, this government was about to fire 10,000 teachers before the pandemic hit. That's what they were trying to do in their budget pre-pandemic. We don't want to see that. We think they need to do the opposite. Kids have had it rough. I mean, parents have had it rough too, working from home and juggling, jobs at home and juggling kids at home and trying to help kids learn. I mean, it's been a tough go for sure, but we know our young people have suffered a lot, mental health wise, socialization wise, but also academically. So we need to see investments in our schools. This is not a time to cut at schools. It's a time to make sure not only are we hiring the teachers and hiring the educational assistants and the other support workers in our schools, but also making sure that there are mental health supports in schools for kids, right? To help, deal with all of the turmoil that they were facing at home and at school. for the last year. And the other piece is jobs. I mean, we really do want to see some attention to jobs and supporting people's employment. And so that means, we really need to see some investments in small business. It still has not been adequate. And we see so many small businesses closing. What we need is direct rent supports, direct supports for subsidizing wages and those kinds of things to help the small businesses get back on their feet again. But we know the pandemic didn't treat everybody fairly. We know there are some communities and some workers who were particularly hard hit. So racialized workers, immigrant workers, women workers, we need to see supports to help people get back into the workforce with decent jobs. And that means we also need to make sure that people have the kinds of supports to stay well, even as we get through the next couple of months of the pandemic. Because let's face it, we're not over it yet. Some are suggesting that it's going to take until well into the beginning of the fall to finally say that we've had this pandemic, under
Behind
control.
us.
Yeah, behind us. And so things like paid sick days. This is something we've been fighting for a long time, but nobody should have to go to work when they're not feeling well because they're afraid of not being able to pay the bills because they're going to get docked pay. So paid sick days are really important, and we certainly need to see them in Ontario, but we also want to see the idea that people don't have to worry about how they're going to manage to schedule their vaccination to work around their work schedule, because we'll see people trying to make more than one appointment to try to juggle all of the work responsibilities as well as getting the vaccine. So just like when people go to vote, we allow them for 3 hours of paid time off to vote, and employers are not allowed to prevent people from going to vote, and they have to pay people when they go off to cast their ballot. In the same way, we should be covering off people's wages when they go to get their vaccine. I mean, we're asking them to do a civic duty to protect themselves and protect everybody else by getting the vaccine. So we should be paying for that time off as well.
I know you made an
Those
announcement
are some of the big ones.
Yes, I know you made an announcement in regards to Scarborough, and you did
Yes.
mention Scarborough, Brampton were areas
Yeah.
where it has been hit hard. Obviously, our audience group is within that area, the Tamil groups as
Yeah.
well. What are the important things that you're hearing from on the ground, both in Brampton and Scarborough, when it comes to both the pandemic and the needs that needs to be included in the budget?
Yeah, I was in Scarborough this morning and talking with Dolly Begum, the MPP for Scarborough Southwest, and I asked her for a kind of a description of what's been happening, because the legislature's not sitting this week, and even when we sit, we don't bring everybody in at once because it's not safe to do that. So I don't see Dolly as often as I would have in the past, but she did update me that that things are dire in Scarborough. The amount of vaccines that are being received by clinics and places that are able to provide the vaccination, they're not getting the volumes of supply that they should be getting to meet the needs of the population. And we know that the Tamil community, as well as other folks in Scarborough, have worked hard all the way through the pandemic. They've worked hard as essential workers. They worked hard as healthcare workers, and at the very least, they need to be given the amount of vaccines that will help them to stay safe and stop the community spread of COVID-19. But very disappointing. And of course, Scarborough has been for a long time now, as has Brampton, shortchanged when it comes to hospital beds. And we want to see a commitment to increasing hospital beds for the Scarborough community. And as you probably know, in Brampton, there's a third hospital that's necessary there as well. And so we want to see some real commitments. These communities like Scarborough and Brampton should not be overlooked again in this budget by yet another government. I mean, we do need to try to provide some fairness, right, and some equity when it comes to healthcare investments and resources. And so we're looking for that in the budget. We're demanding that the premier of the province, acknowledge the sacrifices, acknowledge the commitment, acknowledge the work that's been done by folks in Scarborough, and show some respect and show some gratitude by providing those investments in this budget.
Thank you very much, Ms. Horwath, for your time. Thanks for the opinion, and also listing out the important things that you guys are looking for when it comes to the budget. We hope to speak to you after the budget and see where you stand in regards to what was announced, and obviously in the coming days and weeks. I know there's an election coming up next year, so it's going to be a busy time, and obviously with the pandemic, that's just going to be making it more busy for you. But thanks for taking your time out. Thank you for speaking to our audience, and have yourself a great day.
Thank you so much. My pleasure. Anytime.
Thank you.